Surgery is one of the main treatment options for patients whose mesothelioma is localized to the lining of the lungs, parietal pleura, and has not spread to other parts of the body, metastasized. The main surgical procedure is called extrapleural pneumonectomy, EPP. In EPP, the surgeon removes the affected lung, diaphragm, lining of the chest wall, and parts of surrounding tissues. Removing these tissues aims to eliminate any remaining cancer cells. EPP is a difficult operation that requires removing very important organs and structures. It carries risks of serious side effects like breathing problems, bleeding, infections, and hernias. Despite these risks, EPP may provide the best chance of cure for some patients with early-stage mesothelioma that has not spread. However, many patients are not eligible for EPP due to the extent of their disease or other underlying health issues. For those unable to have EPP, another surgery called pleurectomy, decortication, PD, may be an option. In PD, the surgeon removes the lining of the chest wall and lung, but spares removal of the whole lung and diaphragm. PD aims to remove as much of the lining as possible while preserving more lung function. PD tends to have fewer side effects than EPP but also may be less effective at eliminating all cancer cells compared to EPP. For some patients, PD can still potentially provide a survival benefit when combined with other therapies like chemotherapy and radiation. Chemotherapy is usually the first treatment recommended for mesothelioma that has spread beyond the lining of the lung, locally advanced or metastatic disease. The goal is to slow tumor growth, reduce symptoms from metastases, and potentially prolong survival. However, mesothelioma is generally not very responsive to chemotherapy alone. The standard first-line treatment for most patients is a combination of the chemotherapy drugs pemetrexed and cisplatin. This combination has been shown in clinical trials to result in a median overall survival of approximately 12 months, which is considered one of the best chemotherapy responses seen in mesothelioma. Some oncologists may substitute carboplatin for cisplatin in patients who are not good candidates for cisplatin due to kidney function issues or other risks. For patients who don't tolerate or respond to the standard pemetrexed, platinum chemotherapy, second-line options exist. Single-agent pemetrexed or vinorelbine may provide additional benefits. Clinical trials are also testing immune-based therapies and newer drug combinations in the second-line and beyond settings. However, mesothelioma remains very difficult to treat once it becomes resistant to the front-line chemotherapy regimen. Additional therapies are usually recommended in an attempt to manage symptoms and potentially extend life, but long-term survival is rarely achieved past the second line of treatment. Radiation therapy, called radiotherapy, uses high-energy X-rays or other types of radiation to kill cancer cells and shrink tumors. For mesothelioma, radiation therapy is most commonly used as a postoperative treatment, either after EPP or PD surgeries. Delivering radiation to the chest area after surgery aims to kill any small amounts of the tumor cells left behind in order to reduce the risk of cancer recurrence in that area. Radiation is also sometimes used for symptom palliation to help shrink tumors that are causing chest pain, fluid buildup, trouble breathing or swallowing. Radiation alone is generally not an effective treatment for widespread mesothelioma outside of these palliative settings. Unlike chemotherapy, it does not treat cancer that has metastasized to distant organs. For some mesothelioma patients, undergoing a complex multimodality treatment approach may provide the best chance of improved survival. This involves combining surgery like EPP with both chemotherapy and radiation therapy. Studies have shown that carefully selected patients who can tolerate an aggressive combination of EPP plus adjuvant chemotherapy and radiation experience the longest survival times, averaging around 2 to 3 years from time of diagnosis. However, multimodality therapy is also associated with increased risks of treatment-related toxicities and side effects. It requires specialized treatment planning from a multidisciplinary team at expert mesothelioma centers. Not all patients are medically eligible for such an intensive combined treatment approach. For those unable to undergo surgery or who prefer non-invasive options, Investigational treatments are also being explored. These include photodynamic therapy, using light-activated drugs, heated intraoperative intravascular chemotherapy, delivering high doses of chemotherapy during a surgical procedure, gene therapy, immunotherapy, and innovative delivery methods for established drugs. While very promising in early research, most novel therapies are still in clinical trial or experimental phases of testing and lack long-term data on safety and effectiveness for routine clinical use in mesothelioma. Patients may wish to enroll in trials of new treatments in hopes of gaining access to what works best. While still very challenging to treat, combined modality therapy using surgery, chemotherapy, and/or radiation provides the best chance at improved survival for selected patients with early-stage malignant pleural mesothelioma localized to the lining of the lungs. However, mesothelioma that has metastasized frequently remains incurable with standard therapies. Continued clinical research seeks more effective options to manage symptoms and prolong survival times across all stages of this disease. The treatment strategy for each patient should be carefully chosen based on the specific extent and location of their cancer, as well as individual factors like age, overall health status, and treatment preferences. Close monitoring for recurrence by a multidisciplinary team experienced in mesothelioma care is also vitally important.